Welcome everybody to our National Science Week seminar, where we're going to delve into the topic of all things mobile phones and health today. Today I'm going to be guiding you through a number of different things. So the work that we do at ARPANSA, the science behind mobile phones and how they actually work, some common myths about mobile phones and health and what the real story actually is, and our 4-year action plan at ARPANSA for tackling this topic. At the end of the seminar, we'll have opportunity for questions, and I just wanted to let you know that you can submit these questions at any time throughout the presentation in the Q&A box on your screen. And just note there is a slight delay, so that when you do submit it, it might be 20 or 30 seconds before you actually see your question pop up. So without any further ado, I will get started. So before I talk about all these sciencey things, I might just tell you a little bit about who I am. So my name's Associate Professor Sarah Loughran, and I'm currently the Principal Researcher and Director of the Electromagnetic Energy Program at ARPANSA. But before I journeyed to ARPANSA, I did a lot of other things. So I started many years ago at Swinburne University in Melbourne, where I did my PhD looking at the effects of radio waves from mobile phones on our brains during sleep. And following that work, I spent a number of years at the University of Zurich in Switzerland, where I did a lot more work on radio waves and health. And then I came full circle and came back to Australia at the University of Wollongong this time, where the weather was a little bit nicer than in Melbourne. And I looked at a lot of things in terms of radio waves and health, and I was also the director of the Australian Centre for Electromagnetic Bioeffects Research, where we focused on lots of research on radio waves and health as well. So that was about 20 years of my life almost. So I've done this for a very long time, but it's not all I do. And as you can see from this slide, there are a few other interests that I have. So I have a little daughter, Zoe, who you can see here, who keeps me very busy when I'm not sciencing, because there's not a lot of science around parenting, I've learned very quickly. And I also like to travel, but as we all know at the moment, that's very difficult. So I'm looking forward to getting back to that in the future. And as you know, a lot of Australians, I'm a very big football fan, but I did want to point out before we got into the presentation that just because I'm a Collingwood supporter doesn't mean that I can't also be a good scientist. So now that you know a little bit about me, let's move on to the science, and I'm going to start with ARPANSA. So ARPANSA stands for the Australian Radiation Protection and Nuclear Safety Agency, and we are Australia's primary health authority on radiation protection and nuclear safety. So what that basically means is that our main objective is to protect the people and the environment from the harmful effects of radiation. We provide science-based evidence to advise governments as well as the industry and the Australian public, and we have lots and lots of scientists at ARPANSA that do this in a number of different ways. And aside from that, we also have a vision for safe radiation environment for the Australian community. And this includes a number of different things in what we do, like setting exposure limits for things like telecommunications and mobile phones that we're talking about today, but as well as other types of radiation that you might be familiar with. So things like overseeing chemotherapy equipment, as well as monitoring things like UV radiation that we get from the sun. So that's a little bit about ARPANSA and what we do. And next I want to talk a little bit about the science and history behind mobile phones. So as a lot of us are possibly aware, mobile phones have now been around for quite some time, although I imagine most of us didn't have one of the early mobile phones. So what you see here is the very first mobile phone, which is a Motorola phone that came out in the early 1980s. It was the first commercially available mobile phone. It weighed about 1 kilogram or a little bit over, so not the sort that you'd probably want to be carrying around in your handbag. And it also cost around about $4,000, which is a lot of money now, but in the 80s was even more money. So it was something that not a lot of us actually had. Then came the first camera phone in the year 2000, which was available in Japan, but it was a couple of years later before camera phones actually became available elsewhere. But in 2002, things started to really change, and there was the introduction of the first 3G phone. So we were able to do a lot more from our phones. We were able to take pictures as well as access the internet a little bit more than we had been able to. And very quickly, these functions developed. So in 2007, the first iPhone was released. And it was the first phone with the full internet experience. So it was basically like carrying around a computer in your pocket for the first time. And as we know, we've now got 4G and 5G being deployed as we speak. So rapidly, phones have developed over the last few years. But how many phones are out there? I think, you know, we all think about, oh, we have a mobile phone. We don't know very many people that don't have a mobile phone. So if we look at the population of the world, we have about 7.8 billion people in the world, and of those people, about 5.3 billion have a mobile device. But I think what's really interesting with the figures of mobile phones and mobile phone connections is that there's actually about 10.3 billion connections around the world. So what that means is that a hell of a lot of people out there have mobile phones and use mobile phones, but also a lot of people have more than one connection. So they might have their personal device, their work device, and basically these numbers are only increasing. And I think something to put it into perspective as well is a study that a few years ago asked people, if you had to give up, if I took your phone away from you right now this minute, what would you be willing to give up for me to give you your phone back? And a lot of us might think, oh, you know, I can live without my phone, but I think the results of this survey show us quite differently. So 45% of people were quite happy to give up alcohol and say, yes, I want my phone back. 34% were quite willing to give up chocolate, saying, no, I don't need chocolate anymore, but I really need my phone. And I think even more interestingly is that 13% of people were very willing to give up sex in order to have their mobile phone back. So you can see how pervasive these devices have become in our lives and how important they've become to us in our lives as well. So how do mobile phones actually communicate? So we've talked a little bit at the start about radio waves and the EME program at ARPANSA, but what does all of this mean? So mobile phones communicate via something called radio waves, but they are also called lots of other things which can make it a little bit confusing when you're not in this field. So sometimes they're called radio frequency, electromagnetic energy, or electromagnetic fields, or EME or RFEME. But they're all the same thing, despite the term that might be used. And radio waves are made up of electrical and magnetic components that travel in waves, so that's why they're called waves. And as you can see in this picture, the way in which our phones work is these waves carry data from our phones to base stations or communications towers. And it's these waves that allow us to send text messages or make phone calls or search the web. So it's like imagining little packages of data moving along these waves, carrying it to and from, a little bit like a carrier pigeon, but just much more efficient. And I think the other thing is since having mobile phones, we've talked about radio waves a lot, but what a lot of us maybe don't realise is that radio waves are basically everywhere. So they occur naturally, so they are produced by the Earth and also by the sun, but we also have artificial radio waves too, so the telecommunications types through our mobile phones, but things like Wi-Fi, lots of medical equipment emits different types of radio waves. And radio itself, so the old traditional AM and FM radio, also use radio waves in order for us to hear those songs or the news that we might want to be listening to. And I think one of the most common questions that we get at ARPANSA is, well, are these radio waves bad for my health? Well, the short answer, as you can see here, is If they're within our safety limits that we set, then no, you're safe. But let's go into a little bit more detail about what we mean by safe and if they're bad for our health. So radio waves are something which we call non-ionizing radiation. It's sounds a little bit technical, but what that basically means is that they don't have enough energy to damage the DNA in our bodies, as opposed to things that are ionizing, which do potentially have that energy. If we're talking about health, the primary health concern is when our tissue in our bodies heats up to a certain extent from too much exposure to radio waves or any kind of radiation. But with radio waves, heating is the only known way in which we know that damage can occur. And so ARPANSA sets a national safety standard that protects you and everybody from the overexposure to radio waves, and that's on 2 levels. So it protects you from having this heating, but it also protects you from any other health effects that might occur that aren't related to heating. I'm going to go into a little bit more detail now about how exactly we set the standard and how we do protect your health. So we at ARPANSA set the safety standard that provides protection from the Australian public, and this works in a number of different ways. Predominantly with the safety standard, we set it so that for the public, exposures to things, your everyday devices, mobile phones, Wi-Fi, or things that you might encounter in your everyday lives, there's a safety limit that ensures that these don't emit radio waves at a level that can be harmful. But in addition to that, we also set limits for occupational exposures. So in certain occupations, exposures might be a little bit higher than what we encounter in our everyday lives, and the safety standard that ARPANSA sets also accounts for this. What the standard also does is it restricts public access to areas that might have higher levels of exposure that occupational exposures are allowed to have, but the general public shouldn't be exposed to. So we restrict public access to any areas that might have slightly higher levels of radiation, not necessarily harmful levels, but higher than what's in the public exposure standard. We also have specific warning signs in certain areas that show that you aren't to enter these types of areas if there is a radiation risk. And then we have a management plan. So of course, things can go wrong. And for when those things happen, we have a management plan for dealing with any cases of overexposure that might occur. And I wanted to give you one example here of some of the work we've done at ARPANSA recently to put the standard and the exposures that we might get in our everyday lives into context. So the line that you can see at the moment that says Australian standard, that's the level at which, the safety level at which the ARPANSA standard is set. We did a study in schools looking at levels of Wi-Fi because there's a lot of concern around Wi-Fi exposure to children. And so what we did was we did some environmental measurements to see, well, what are the actual everyday exposure levels that people might be exposed to. And from this study, what we saw was that the Wi-Fi was actually about 100 million times below the safety level that is set by the Australian standard. But we also looked at other types of exposures that we might be interested in as well. So lots of people use TV, and we thought, well, how does that compare to what we see with Wi-Fi? And what we saw was that TV was about 3 million times below the Australian standard. So again, very much below the safety limit that we've set at ARPANSA. The other thing that people are always interested in is mobile phone towers and the exposure that they might receive from a base station. And again, this was well below the standard at about 500,000 times below. But interestingly, what was the highest of these exposures, but still well below the standard, was actually radio towers. So something that we've had in our everyday lives for a long, long time was well below the Australian standard at 50,000 times below. So basically what this study was able to show was that all of the things that we're exposed to in our everyday lives are well below the safety limits that we set at ARPANSA. But I think it's also important to point out how the standard is actually set, so how we actually make the standard. And that standard line, or the level that we set the standard at, isn't that line of, well, if you instantly cross that line, it's all death, doom and gloom. There's actually a large safety factor built into the Australian standard based on science. And what you see is that the Australian standard is set 50 times below where we would actually see an effect occurring. So not only are all these devices that we use in our everyday lives well below the safety limit that we set, the limit at actually where something would occur is also well above that. And this is just another message again showing us how safe these devices that we use every day are. And so at ARPANSA, a lot of the time we get a lot of questions about mobile phones and health, or radio waves and health, but in the general public as well. So it's in the media a lot. I'm sure everybody that's attending today has seen lots of things in the media. And it's hard sometimes to know, well, what is right and what is wrong, or, you know, should I be worried or should I be concerned? So what we thought we would do today is come up with some of the most common things that we see in the media, basically some myth busters of what you might see and what the actual real story is behind some of these common misperceptions around mobile phones and health. So firstly, something that we've seen very recently, because 5G is new and currently being deployed in Australia and other countries around the world, is people thinking that the new 5G mobile network will expose the Australian public to dangerous levels of radio waves. So a lot of people are very worried about this, and there's a number of reasons that people might be worried about this. For example, we do know that with 5G, we will need lots more antennas than we might have needed in the past from other 4G, 3G and other generations of mobile phones. And a lot of people equate more antennas to higher exposure. But actually that's not the case at all. The technology just works very differently. The waves travel a shorter distance, and that's why we need more antennas. And it's also important to note that the 5G mobile network, although it sounds new, 5G is using radio waves just like 4G and other generations used. And the research that we have done and that's been done around the world has looked at radio waves, and it doesn't matter which generation of mobile technology is using them and how they're using them. We know a lot about how these radio waves work and how they interact with the human body. So what we can say for this one is that the radio waves are no different to what we've seen in the past. There will be some different frequencies used that are also used in technologies at the moment, as well as that, as per all other telecommunications, they will remain below the ARPANSA safety standard. Another one is that 5G is new, so there's not enough research to show that 5G is safe. So this is quite similar to the previous one in that, like I mentioned, there's been a lot of research done on radio waves in general, so we do know a lot about how radio waves work, and that's how we're able to derive these safety limits and know that 5G indeed isn't different to 4G or 3G in terms of how we set the safety limits. It's also important to note that the new ARPANSA safety standard, which was released earlier this year, has taken into account the new frequencies that 5G will use and incorporated some extra changes and safety factors to ensure that higher frequencies that will be used with 5G are definitely safe for us to use. Something else that we hear a lot is that our safety standard at ARPANSA is not as safe as the stricter standards seen in other countries. Now, while it is true that some other countries have safety standards that they have set, or safety limits that they set, that are different to ARPANSA's and may be deemed by some to be safer, these limits that are set by other countries are actually not based on science. They're based on a lot of times public concern and political reasons. So in terms of what we do at ARPANSA is we set the safety standard based on best international practice, and it's 100% science and evidence based. So while other countries may decide to increase or decrease the limits that they have, all that we do at ARPANSA is look at best international practice and set our safety standard accordingly. So there's also, as we get into physics and things that are a little bit more complicated, sometimes people think, well, one source of radio waves might be safe, but what about exposure from multiple sources? Because I have a phone and I have the Wi-Fi on at home, and then there's the cell tower down the street, and is that something that I need to be worried about? And what it's really important to know is that the safety standard that we set at ARPANSA protects against all of these sources. So it's not just about mobile phones, even though that's mainly what we're here talking about today. It protects it against all of the devices that use radio waves. And it's important to note that these exposures are not cumulative. I think the other important thing to point out here is, as we saw before from the ARPANSA study that we did, you can see that these sources are well below the safety standard level as well. So they're not anywhere near approaching what is deemed to be safe anyway. So I think it's safe to say that we know that even if you're using multiple sources, this doesn't change anything. The other thing that people sometimes ask us is that there are studies that show harmful effects from radio waves. So why does ARPANSA ignore these? Now, it's definitely true that some studies show harmful effects from radio waves. And the important thing to point out is that at ARPANSA, we don't ignore any of the science. So when we're looking at our safety standard or developing any kind of advice or fact sheets, we actually look at the entire body of science. We look at every study that has been done. But there's more that needs to be done than just looking at, does something show an effect or does it not show an effect? So the important thing here is that the quality of the study needs to be assessed. And what we have seen from research into radio waves and health is that the studies that do show harmful effects tend to be of low quality, or they haven't been replicated. And replication is one of the important things in science that we need to show whether something is or isn't causing an effect, which I'm going to go into a little bit more detail on the next slide. So how do we assess the available science? So it is something we get asked a lot. And there are a number of important considerations when assessing the evidence, and this is really, really complicated stuff. So it's why we need, good team of scientists that are able to do this, and why it can be difficult for those in the public sometimes to understand why one study showing something isn't enough for us to be able to make these important decisions. So as I mentioned in the previous slide, the quality of studies is incredibly important. So we need to look at how a study was done, the different types of protocols they use, and some are definitely better than others. And so we take the quality of the study into account when we look at the results that they might be reporting. And anything of low quality cannot be used to make any kind of determination about whether there are effects or not effects from mobile phones or from anything, because this is just how science works. This is not just about mobile phone science, this is science in general. The next important thing that I alluded to in the last slide was are the results replicated? So replication means that a study is done somewhere, and what's deemed to be a good study, hopefully, and then the results are also done somewhere else, or the study is done somewhere else. So if one laboratory or one group of scientists is able to show something, and if indeed that effect is real and true, then this should be able to be shown in other laboratories. So if that's not the case, then one single result showing something doesn't really tell us much. And so we need to look at science that's been able to be reproduced time and time again to show that indeed we really do have a real effect here. The next thing that's important is the different types of studies that we have. So there are lots of different ways that we're able to look at, is there a connection between something? In this case, is there a connection between mobile phone radio waves and health? So we can look at human studies, so sometimes epidemiological studies where we look at different outcomes and whether they are associated with different exposure or mobile phone use patterns, for example. And then we can look at humans in the laboratory where we're able to expose them to a mobile phone and do some tests before or after. And then we can look at animal studies, which can be really useful as well, because we can give them exposures for longer periods of time sometimes and look at different outcomes with animals. And then we're able to also go into the laboratory and look at cells and look at how cells might respond to different types of radiation. And what's important is that when we do all these types of studies, if we do think there's an effect, then ideally we should be able to see an indication of this effect across many different types of studies and not just one. If we're seeing it in just one type of study, there's an indication that there might be a problem and there might be some sort of bias, and that, again, the effect might not actually be real. Another thing that's really important is the mechanism. So how does the exposure cause the health effect that we're seeing? So it's really important that we're able to understand, if we are seeing an effect, well, why is this effect occurring and how are the radio waves interacting with our body to cause this effect? It's also important to point out, though, that even without a mechanism, an effect that has been replicated in good quality studies and different studies would still be deemed an effect and would still be considered in the ARPANSA safety standard, despite a mechanism not being identified. But then it would also be important that future research would look at identifying what that mechanism was. And then another thing that's important is looking at dose response. So basically that means if we have more exposure, do we have a greater risk of whatever the effect is that we're looking at? So these 5 things are really important when we're evaluating the science and really help us to come to the decisions that we make at ARPANSA for setting the safety limit and being sure that the safety limit that we're setting is indeed safe. So basically now that we've had a little bit of a background on mobile phones and health, I'm going to talk to you a little bit about our 4-year radio wave action plan and what we're doing at ARPANSA in this field. So there are a number of things that we're doing in order to further the science and also make sure we never stop working in the background. Even though we are sure that our safety standard is safe, there's always more that we can learn and always improvements that we can make. So there are a number of different things that we're doing as part of the Electromagnetic Energy Program to make sure that this is the case. One of those things that we're doing is updating the ARPANSA safety standard, which we just saw previously and I've talked a lot about today. So earlier this year, we released the new ARPANSA safety standard, which we updated based on a number of different reasons, but one of those was that the International Commission for Non-Ionising Radiation Protection had updated their guidelines, and because ARPANSA follows best international practice, it was very timely that we also updated our safety standard. And what I can say and what I mentioned before was that although things didn't change dramatically, a number of changes were made to include those higher frequencies that we know the 5G systems will be using in the future. Another thing that we're doing as part of our electromagnetic energy program is that we're assessing radio wave exposure in the community. So it's one thing to have a standard, but like we saw in that study that we've done previously, it's very good to be able to see what the levels actually are in real life and in practice. And this is even more important now that 5G is being deployed. It will give us an idea, particularly as we do it now, of what the baseline levels are before we have 5G widely deployed in the community, and we'll also be able to see what levels are in the future as 5G becomes more and more prominent in our community. It also allows us to do other types of measurements. So we have measurements planned for different high level occupational exposures. So people that work in occupations that we know are exposed to higher levels of radio waves. We'll be doing measurements on those people. And over the next 4 years, a number of other different measurements as we roll this program out. Another thing that's really important, and one of the key things for our EME program, is research. So we can never know everything, and it's really important that we continue to research radio waves and health, and there's always more that we can learn on this topic. So to start with, recently this year we've published 2 world first reviews that look specifically into the types of radio waves that 5G use and health, both of which were able to show that, as we've said, there's no substantiated evidence that 5G harms humans. So these are the first radio waves reviews that have been done, and they support what we have been saying in our advice. In addition to that, there's a number of other research programs that we're undertaking. We are engaging with a number of different universities and involved in a number of different studies that are going on, including the supervision of some doctoral students on different topics. And we also have a research framework that we have developed that's going to look at high priority research in the area of radio waves and health, and how we can support that in the future. And our first call for research from this research framework will be happening later this month. In addition to conducting research, another big project that we're undertaking at the moment is updating our radio wave laboratory. So in addition to updating a lot of our equipment so that we are able to do measurements and things in the higher frequency areas that 5G will be using, we are also building a brand new laboratory like you see in this picture. It's called an anechoic chamber, or a blue room sometimes, and we are currently in the process of building that. So this takes quite some time, and this is a project that's been going for about a year now, and we expect that in about another year we will have this laboratory finished, up and running, and able to do the work that we've already been doing there in the past, but also a lot of new work looking at higher frequencies that our current laboratory doesn't have the capability of doing. Another important aspect of the mobile phone and health issue is international engagement. So at ARPANSA, we follow best international practice, but we're also a part of the key international stakeholders in this field. So a number of members of our electromagnetic energy team are involved in ICNIRP, or the International Commission on Non-Ionising Radiation Protection, who set the guidelines for these radio waves, but also all other non-ionising radiation protection issues. We're also heavily involved with the efforts of the World Health Organization, including systematic reviews that the World Health Organization are doing, and we've supported this year the World Health Organization's radio wave research. So these are just 2 examples of the international engagement that we undertake at ARPANSA, but there are many, many more, and we sit on a number of different important committees and standards as well in terms of this area. And the other thing that's important is what we're doing today, which is providing information on radio waves and health. And there's a number of different ways in which we do this. So events like today and being able to talk to you, the general public, is one way in which we provide information. but there's a lot of other ways. So we, apart from the research that we publish, we are very heavily involved with social media. So we're often putting facts and questions out on social media that people are able to engage with. We provide briefings to government and council to make sure that we can reach the public through those means as well. We also have lots of fact sheets on our website, which people are able to download and read through, and which have a lot of information on them. And we have a Talk to a Scientist program, which is something quite unique to ARPANSA, where people are able to actually engage with a real scientist and ask basically whatever question they want to ask around radiation and health. And that's not just radio waves, but that's all types of radiation, because at ARPANSA we deal with all types of radiation. So we are working hard to provide information on radio waves and health to the public, but on radiation in general. So just to summarise what we've talked about today before we move on, we've learnt a little bit about the history of mobile phones. We've learnt how mobile phones communicate through radio waves and how that works. We've also talked a lot about ARPANSA's role in how they protect you and your health from these types of radio waves and what it is we do here at ARPANSA. We have myth busted a few of the common questions that we get, but I'm hoping that there'll be a few more that come in that perhaps we haven't covered today in the presentation. And we've also talked about the ARPANSA EME program and our action plan. So how we're doing things at ARPANSA to ensure that we stay up to date with the research and knowledge in this area and can provide the best protection for the Australian public possible.